There are a couple of different things that you would need. First, how is that patient actually responding to the course of treatment? How does that actually affect the course of treatment itself? So how does it actually affect the site that you're focusing on? And then also, what's really important to collect is information about what that patient actually wants. So the focus in making sure that that patient is an equal decision maker in their care, and the documentation of what a patient wants and what it matters to them in terms of the quality of their life and not just the quality of their care. When you actually know what works for a patient, the more data you have in order to understand that, it moves the decision making from a judgment or a one-off decision for a patient into a pathway that you know can be more effective for that patient and patient experience. So it starts to take the guesswork out of that course of treatment for a patient. That ultimately improves the quality of life, the quality of the course of treatment for that patient. I have seen a number of interesting ways that data has helped include palliative care. So palliative care is pain and symptom management for people who are living with a serious illness, and it can be provided alongside that course of treatment. When you're able to integrate those two things by, say, placing a trigger for a patient who has advanced disease so that they can have a conversation early in their course of treatment about pain and symptoms, that allows an oncologist to really affect clinical decision making, to make sure they understand what the patient's goals are, and it can actually inform the treatment path for that patient. Sometimes that might mean that a patient would fall outside of a pathway because they understand or have different goals of care than another patient. And that helps an oncologist really understand what a patient wants and needs, even if they're going to survive from that cancer, and especially if they're going to survive from that cancer. So what it allows for is the judgment to be moved from the clinical decisions that you're making about a patient's treatment to understanding more about what matters in terms of the quality of life for that patient and family.